You are listening to the Toxic Mold Podcast with my husband, Steve Worsley, the toxic mold expert and your number one source for mold consulting and mitigation in the USA. Here is episode 165, Toxic Mold and Barbecues.
Before we get started on this episode, a short or not so short disclaimer. While all attempts have been made to verify the content provided in this podcast, neither the podcaster or the producers assume any responsibility for errors, omissions, or alternative interpretations of the issues discussed herein. All information stated in this podcast is the opinion of Steve Worsley. Steve Worsley is a mold specialist with over 20 years of experience in the construction and mold industry. The Toxic Mold Podcast is for information sharing purposes only. The views expressed are those of the podcaster and his alone. These views should not be taken as expert instruction or commands. While there may be references to medical conditions and symptoms, all solo podcast episodes are the opinion of Steve Worsley, and any medical questions or concerns shall be addressed with the appropriate licensed medical professional or professionals. As the podcaster refers to different mold types, please be aware that Steve Worsley is not a microbiologist, and questions concerning mold specifics should be answered by the appropriate professional. The listener is 100% responsible for his or her own actions. You can check out Steve's books on Amazon about mold and dealing with mold in your home at amazon.com/author/Steve Worsley. And if you're interested in scheduling a mold consultation, over the phone consultation with Steve, you can be sure to find out more about those and his availability at cnccontractorservices.com. Now, let's get to the episode. Hello, everybody. Welcome to a brand new episode of the Toxic Mold Podcast. Today, Steve, we are talking about toxic mold and barbecues. What made you think of this topic?
Well, last week obviously was 4th of July, so I don't remember what we talked about. I think summertime, mold in the summertime. So then I was just thinking about foods, and remember we did our little case study thing with the Burger King?
Oh, that's right.
We didn't use Burger King. Oh, I think we used Wendy's. But anyhow.
We used somebody.
Yeah, we did our own little thing compared to our own hamburger to see which would mold quicker, which had, more mold types and all sorts of stuff. And it didn't turn out the way I thought it would, but, we didn't really report on that. But the reason we did that was, remember, Burger King came out with a commercial showing mold on their hamburgers. Do you remember that?
That's right. I do remember that. Yeah.
So anyhow, I just, a lot of people, when they think about mold on food, they think of penicillin, and they're like, well, I take that for antibiotics, so it's just fine if it's on my bread or cheese or whatever. So I just thought it was something we could talk about, and, we repeat ourselves a lot in our podcast, but that's the point, so our listeners know, all the important things or the things I feel are important.
Well, but going back to the whole thing about mold and food being concerned, I've seen lots of people, they find a little bit of mold on their bread. They just cut off the part with the mold and keep eating the bread. Is that...
It's a surface mold if it is, yeah.
Okay.
So mold on your cheese to me is a lot different than mold on bread.
Why? Because
the cheese isn't as porous as the bread is. So the bread has obviously more voids. It's not as dense, so it's more porous. So trying to cut that out, you could try to, versus cheese is a lot different. Like on cheese, you just cut the mold right off. And I'm not telling our listeners to do that, but
that's where my question is mold in food a concern? Because lots of people act like it isn't. They just snip the part off that has the mold and they keep eating it.
Yeah, and obviously I think mold's always a concern, but yeah, mold in foods is not. That's the last thing you want is to ingest mold spores. And it might not affect you, but it might have really negative effects. And those molds could start producing mycotoxins inside your body. And then we go down the whole road of detoxing and all that stuff. So I guess my point is you could have mycotoxins and mold sickness symptoms due to ingesting mold from food, and the air quality in your home's fine.
And it's just that you're ingesting mold.
Exactly.
Okay.
So then it would seem to me that different molds will show up on different foods under different circumstances, right?
Correct.
So what types of mold will people find on food typically?
So we mentioned the penicillium, but the most common ones, and I had to Google this because I'm not a microbiologist, but the most common ones are Alternaria, Aspergillus, Cladosporium, and Penicillium. And Penicillium aspergillus are typically classified in the same mold classification because they're so similar. They are two different mold types, but when it comes to air testing, usually they're classified in the same category. But, for our listeners, Penicillium, they're like, yeah, that's, cheese and stuff like that. The Cladosporium is typically what you're going to find on your bread. So you have a little more of a greenish color versus a more whitish color. So a lot of it depends, though, on what the food is. Just like in your home, when we run air testing, there are certain mold types that are associated, let's just say, with water-damaged sheetrock. So it'd be the same concept with food. Depending on what food it is, would introduce different mold types.
Okay, that...
Did I confuse you?
Yes, you did. So let me put it a different way. So in the mold epidemic, you talked about toxigenic, pathogenic, and allergenic molds. And then now you just mentioned that most of the mold you'd find on your food are like Aspergillus, Cladosporium, Penicillium, Alternaria. So which groups do those types fall under? Is Penicillium an allergenic mold?
So they could be classified as all three.
Okay.
And so once again, depending on what mold types, and then the subtypes, so it's subgenus is what they call it, subspecies, would determine that. But it can be classified as all of them.
Oh.
Penicillium could, let's just say Penicillium along with Cladosporium, those inside your body could produce a mycotoxin, which could, we would say it's toxigenic. So, and I know that sounds confusing to our listeners, but when we've talked about those mold classifications, they can fall under different categories or all three.
So then why is it important for listeners to understand the mold classification? What does it tell people?
Well, honestly, for me, I don't think, to me, it's somewhat irrelevant, if that makes sense, because, some people are allergic to peanuts. So they can have, what's it called, anaphylactic shock or whatever the reaction is, and they need an EpiPen. Where someone like me, it's fine. So for one person, it could be fatal, per se, where somebody else it's not. So that's just what, that's how we classify them, allergenic, pathogenic, and toxigenic. And that is so that we can say, and if it only causes an allergic reaction, then it would be allergenic. If it causes an infection, that would be pathogenic. Does that make sense?
That does make sense.
So a lot of it just depends. And
if it creates mycotoxins, it's toxigenic?
It's toxigenic.
So then
when you cut your arm, does everybody's arm or the cut always get infected?
No.
So it could just be a cut, then it could actually turn into an infection. Does that make sense?
That does make sense.
A lot of it's how your body reacts to it.
So would you say, in your opinion, that most of the mold that you'll find on food live in the allergenic or pathogenic route? Or they could be all three?
It could be all three.
Wow, that's complicated.
And once again, this is way out of my expertise. I'm not a medical doctor. I'm not a specialist when it comes to that. I'm not a microbiologist, but it could be any of them.
Okay.
And so that's why, it needs to, I'm not saying you have to freak out over, you saw mold on your cheese. Now you need mold mitigation in your house. No, but you should, be cognizant of what that mold can do to you.
But if you're seeing mold on your food in general, my first assumption when I see mold, especially on bread, is, the store sold me old bread. Would that be accurate, or are there many more factors involved than just...
Well, you'd have to have the same factors as you do for mold infestation in a home.
Okay.
And you have the mold, the three main things. You have to have the mold spore, you have to have a food source, so cellulose materials, and you have to have elevated humidity over 60%. So mold on your bread, depending on the preservatives, how the bread's made, the yeast they're using, all sorts of different variables. You could buy one type of bread that will be moldy in a week. You could have another type of bread that it takes a couple weeks. A lot of that's dictated by the brand and what's in it. But if you have mold on your bread, do you typically see that when the bag is open? Meaning, the kids leave the bag open. Would you typically see mold on that bread? Because the humidity is not elevated.
Okay.
So the moisture in the foods, we're talking about bread, so the moisture in the bread, not meaning that it's wet, but there's moisture in it, that obviously will become elevated if the bag is closed. If you open that bag, you're going to have a hard time finding mold because it airs out and it dries out. And the mold spores cannot become viable, alive, reproduce, however you want to word it.
So that makes a lot of sense. How do you explain mold in a refrigerator? Meaning you keep it nice and cool, the humidity's low in the fridge, and all of a sudden you open up and your cheese now has mold on it.
So once again, just for a question for our listeners, and I'll just ask you this question. Have you ever seen mold growing on something that came out of the freezer?
No.
Because it's frozen. The mold is not viable. It cannot reproduce. It's frozen.
Yeah.
It's no different than dormant grass in the wintertime. The fridge isn't. The fridge isn't frozen. Most people keep their fridges like at 38, 37 degrees, so it's above freezing levels. For mold to grow in the fridge, going back to what you're saying, so a lot of the newer fridges, you have humidity control for the drawer that has your vegetables in it. You know, the little slider things you have. And how that works, I have no idea.
Yeah.
It would obviously have to have something to do with the water dispenser. But even if you didn't have that, the mold on your cheese, that cheese is not just sitting on a plate, correct?
Correct.
So it's probably in a bag, Ziploc, which it's contained. So any moisture from that cheese elevates the humidity, then it starts to grow. Now, going to the whole fridge, it's cold. Different mold types thrive at different temperatures. So obviously something like the mold on cheese, which is typically penicillium, it can become viable and reproduce at that temperature.
So mold is very tough. It can take a lot of different environments.
Yeah, exactly. I mean, it's no different than any microorganisms, and
it's built to survive.
Yeah, that's how the earth and life works. You know,
Exactly.
Again, I'm not a specialist in that, but yeah, it can thrive under any conditions, and it's no different than the flu or colds. They're always morphing, so they have to survive just like we want to survive.
Okay, that makes a lot of sense. Is there ever a condition with mold in food where mold is actually used?
Yeah,
Like, used for stuff?
yeah, like blue cheese.
Yeah. Oh, that's moldy.
Yes. So
wait, how is blue cheese made now?
you'd have to ask those experts, but
They let it mold?
It's aged.
It's
and,
aged.
yeah,
Okay.
So that's why it's called blue cheese.
Okay.
But they've deemed, once again, and this is FDA or whoever, the governing agencies, that is safe to eat. Now, going back to the whole eating peanuts, if one of our listeners has a child that's allergic to peanuts, that child cannot even be around peanuts. It's just toxic for them. But the parent can have it. So it's the same concept. You might be able to sit there and eat blue cheese. We like blue cheese.
Yeah.
But if you have an allergy to it, then it'll cause issues. But they say it's deemed safe. And I would be a hypocrite if I sat here and said you shouldn't eat blue cheese because I like blue cheese. So
yeah, that's true.
Now, do we eat blue cheese with active, viable mold growth on it? No.
No.
Like if you get in your fridge and you can buy the blue cheese, just the crumble. I don't know what you call it, but you know what I'm talking about.
Yeah,
just the crumbles, not like
crumbles.
in a dressing.
Yeah, the cheese block crumble thing.
Yeah, just kind of cut up, broken off, whatever you want to call it. But if there was mold, you could see active mold growing on it, I would not eat it.
Correct.
Even though I like blue cheese.
Correct.
So I know that was kind of a non-answer, maybe I'm not sure how to say how I said it, but But it sounds hypocritical, but, there are things it's no different than penicillin. You take that for if you have any, any infection that's obviously bacterial.
Yeah.
And so, our listeners would be like, well, so how does that work, Steve? Like, you're saying, well, you can take antibiotics to get rid of an infection, but you're saying, high counts of penicillium is what we call it as a mold, are bad for me. Well, once again, if you're taking a pill, it's such a low dose, it's not deemed to be harmful. And there's some people that can't take penicillin.
Yeah.
They have to take a different
thing,
amoxicillin or whatever, So it's very complex, and our listeners know that. I mean, I don't want to sound like I can't give straight answers, but that's why mold's so tough.
Yeah, because it morphs, it changes.
Yep.
And it's super complex.
Yep. And when we get to the building side, that's where, that's why it's so complex. Like, we can't just run air tests and go, yeah, you're good, if that makes sense, as far as air quality. We got to do air tests. We got to do an inspection. We've got to get the history of the people in the home. They got to do blood work, urine testing. It's not just a simple, yeah, the air is good.
So then what do you say to the listeners after we've said all of these things? How do they avoid having moldy foods that are not good to have around?
So, like I said, and I would say, and I would have to say it this way, if there's any concerns, you don't want to eat it, period. There's no reason to take a chance with it. So if you find that moldy food in your fridge, just throw it out. It's not even worth trying to shave it off of the cheese or whatever stuff it's growing on. Cheese, a lot of people will just cut it off.
Yeah.
Have I done that before? Absolutely. Do I say it's safe? Well, I'm alive, so.
But you never can tell.
No.
Because, it's just not necessarily safe. So, really, you're saying if questionable, throw it out.
Yeah. Yep.
Yeah. Okay.
Yeah, it's not, I just want our listeners to know that even if penicillium, as far as a mold type, is fine as far as it's penicillin, the penicillium is a mold type that you have on bread or cheese is not the same as taking an antibiotic.
Yeah. Very, very different. So if it's moldy, if it's questionable, chuck it, clean your fridge often.
Something that most of us don't like to do.
Exactly. And so I've noticed that the way that you store the food in the fridge is really important.
Correct.
So how should food be stored to avoid mold?
Well, the best way to answer that's vacuum sealed, but most people don't have, vacuum sealers. We use one for the freezer, but, if you were to vacuum seal things, but it all depends on what you're doing it with, would be a better option. But at the end of the day, I saw a commercial and I can't remember the wording, but it was something to the effect that your fridge and freezer are not, they're not a museum or they're not architects or I don't remember, but at the end of the day, just clean your fridge out. I mean,
well, and you have to store different things differently.
Yeah.
Because I put raspberries and blackberries in an airtight container and they ended up getting moldy in a couple days because they need air. They need holes in the containers to breathe.
Exactly. And, we've tried different things. Like, we've tried to vacuum seal lettuce. Mm-hmm. And it makes it a lot more compact and easier to store, but the lettuce doesn't last very long at all. So you're right. There are certain things that need to air out. That's just, and what I typically say, and our listeners know this, however you bought it at the store is how you should store it.
Correct.
So if your avocados were refrigerated, you'd keep them in the refrigerator, but they're not.
Correct.
So, that's, to me, it's fairly simple, but just don't think that, you're collecting. Collectibles, I think, is what that commercial said.
Oh, okay.
Some insurance commercial, and he says that this is a fridge. It's not they're not supposed to be collectibles or heirlooms or something, but, it's just best to throw that crap out.
Okay. Questionable, throw it out. What's your call to action for people?
We just talked about it. Clean your fridges out and check, there's some people that go through a loaf of bread every couple of days, so they never worry about it. There's other people that, depending on the brand, they could keep their bread for a couple of weeks. But just make sure you check things. I mean, you could be eating raspberries. The top layer looks fine, but then you get down a few layers or down a little further in the container and there's mold. Well, if there's mold on the lower stuff, there's probably mold in the stuff you just ate.
Yeah.
So
yeah,
throw it out.
Throw it out. And if you've got questions, you do consultations.
Yep.
So people can go to cnccontractorservices.com and learn about the various types of consults because you've got more than one type.
Yeah, we have different options depending on what's going on. So if they're doing mold mitigation, we have options where we are actually the consultants, to come up with the action plan. Some states require you to have that action plan or scope of work. I'm not sure how everybody wants to word it, but there are different options. And a lot of times it's just the normal consultation that, we send you a questionnaire once you've paid. We send a receipt and then a questionnaire. We try to gather all the information we can. And I've never had a client that hasn't been satisfied with their consultation because we want to get to the bottom of it. And we don't treat you like you're like the last, client that we used, if that makes sense. Mm-hmm. Everybody's situation's different. So,
and this is customized consulting.
Exactly.
That makes a lot of sense. So you can learn more about the consultations by going to cnccontractorservices.com. We'll catch you on the next episode. Prevent toxic mold exposure before it gets in your home. Download Steve's free mold investigation checklist at tinyurl.com/CNC mold checklist. Again, download Steve's free mold investigation checklist at tinyurl.com/CNC mold checklist.